Hello, I'm Tamara Banks. I'm so glad you could join us for this important conversation around healthcare politics in America. Please welcome Donna Smith, Executive Director of Progressive Democrats of America. Donna's been engaged with PDA since 2007. She co-chaired PDA's National Healthcare Not Welfare campaign, and she's spoken in 43 states, Washington, D.C., Canada, and Australia about the U.S. healthcare system and single-payer reform. Welcome, Donna. Thanks so much for being here.
Thank you so much for having me.
And we have this exclusive interview, so I'm so privileged and honored to do this with you.
Thank you. It's an honor for me as well.
We're going to talk about healthcare, but first, tell us a little bit about Progressive Democrats of America.
PDA is a terrific national organization that works inside and outside the Democratic Party to put pressure to reform that party into one of true progressive ideals. To take it back to its FDR roots is what we really hope to do. We have chapters organized all over the country, from Hawaii to Massachusetts, Florida, all over the place. And we're very proud of the people who push their representatives in Congress and their senators to sponsor the right kind of legislation and to elect more progressives to Congress.
So speaking of legislation, and a hot topic right now is repealing Obamacare, the Affordable Care Act, and that bill is, of course, sponsored by, it's the Graham-Cassidy bill, named after its sponsors, Senators Lindsey Graham, Republican from South Carolina, and of course Bill Cassidy, Republican of Louisiana. And essentially, one of the key things they want to do is have the states have the right to control healthcare. Tell me your thoughts on this plan.
I think it's a terrible plan, and I think it's probably the worst one the Republicans have come up with so far. I've become a little bit fond of calling Republicans Trumpublicans right at the moment because they don't seem to be able to distance themselves from a president that is very divisive and is doing great damage to a lot of the things we care about in this country, including health care. And the Graham-Cassidy bill really does damage to a lot of things that we won't know until the states try and dive in and deal with pre-existing condition clauses, which the states will be able to modify should they so choose. It's going to be a real problem for an awful lot of people all over the country. As many as 30 million, we understand, could be losing health care coverage through both just not being able to qualify for the expanded Medicaid benefits that may go away, but also because of affordability. The premiums for those people, for instance, for me, as a 62-year-old three-time cancer survivor, it's not likely any insurance company's clamoring to get me on their coverage, and the cost could be just exponentially high for me to have coverage whatsoever, and I'm not alone.
Well, first of all, congratulations on beating cancer 3 times. 3 times it's out, right?
I hope.
Tell us a little bit more about those pre-existing conditions. It's not just cancer, it's a lot of things.
No, I mean, I have asthma. That's a pre-existing condition. I've had it since I was a child. And so every time, if they want to exclude those things as they used to do in the past, I know there used to be policies where you would be excluded for a year from coverage for whatever your pre-existing condition was. That could be diabetes. It could be any number of the public health concerns that we have in this country right now. Opioid addiction. Talk about problems with drug addiction. We have so much trouble with that in our country right now. And the reality is taking health coverage away from people takes health care away from people. And while I very much support getting beyond the Affordable Care Act, the first thing we have to do is stop this so that we don't have so many people who have so many conditions end up worried, concerned, like we have been every day since November 9th.
So what about states having the control over health care?
I think that's just not a function that most states can really take on easily, considering the block grant structure that they really would like to do. They would like to give states a chunk of money and say, there, you manage your Medicaid population. Your people who are poor or most vulnerable, you take care of them. Well, if they cut the amount of money that's going into those states for Medicaid, there's no way Colorado, for instance, my home state, Colorado, can afford to keep everyone covered on Medicaid without raising its own taxes or doing away with other programs that are very important for its citizens. So under this guise of federalism that you hear them talk about right now, what they're really doing is taking us back to a more market-driven, less assured, certainly less guaranteed, and not universal coverage for everyone in this country. It becomes a system where some people definitely will have access and some people definitely will not.
Is there anything in Obamacare that needs to be changed or revamped or looked at and rethought?
Of course, I almost can't let you finish that. Of course there is. There's so much that, and I think most of our legislators, even the Democrats, know that. They know that prices for premiums have gone too high, that insurance companies have upped those premiums every year that have gone by. They know that a lot of families still can't afford the coverage that's offered on the exchanges. So that the cost curve must be addressed. We have to address that. We've got to be able to negotiate for prescription drug prices. So there's a lot of things about the Affordable Care Act that do need to be adjusted. You know, Governor Hickenlooper here in Colorado was working with Governor Kasich to come up with some kind of bipartisan fixes that would at least get us to the point where we could have that debate in regular order in the Senate, where we could really hear from everybody on what is needed in terms of fixing the Affordable Care Act. And one of the things they really talked about was this issue of compassion for one another and making sure that we don't just pull the rug out from underneath people around us in our communities, whether they're Republican or Democrat, doesn't matter. Heart disease doesn't know what politics you are. A stroke doesn't know, oh, I don't want to deal with a Trump supporter. I think I'll do that with someone else. It's just not that way.
You know, people who are 20, 30, even maybe early 40s, their eyes kind of glaze over when you start talking about healthcare. They're thinking, I'm healthy, I'm young, there's nothing wrong with me, I just really don't care about this right now, I can't think about this right now. What should young people know and understand about healthcare?
I think they know more than we give them credit for, first of all. Yes, I think I think about myself at that stage and feeling like the world's in front of you. And you're never going to have all those same problems that you've seen older people have. And yet, younger people around you have accidents. Young people do indeed get cancer. Their families are changed. I've spoken at college campuses where people will relay stories about their parents or about things that happened in their own families that really changed the whole course of their lives. I also heard one young woman speak during a hearing one time on healthcare, and her one line was so devastating to me. Her name was Vanessa, and she got up and she said, I often wonder what I might have become, because she has a chronic bowel problem, and she works when she can, gets insurance through an employer, and then when she's too ill to work and loses the job, she does what's called churning. She'll end up on Medicaid, she gets her care there, and then when she gets well again and she's able to work, she goes back, so she churns from private to, and she stays doing work that she may not really have a passion for because of insurance. And when she said that at 23 years old to a whole group of legislators, I wonder what I might have become. It was breathtaking to me to think, what are we doing to an entire generation of people who may not yet know what they're facing and who do work as compassionate, caring human beings who we understand don't have this same drive to achieve great monetary success sometimes that drove earlier generations of Americans. And what a rude awakening you can come to in just a matter of hours if you get sick or hurt. And you need to be protected. We all need that kind of protection, and it's best done in solidarity with each other.
I want to ask you about, you've worked with the Nurses Union, so switching gears just a little bit. Tell me what your thoughts or fears and concerns are, if you have any, related to the Nurses Union and President Trump's opinion about unions and how he speaks of them.
Well, Donald Trump does a lot of damage on a lot of fronts, but there is no time more important than now for all employees, certainly nurses and others who work with the patient population, to be able to unionize. I mean, it's such a basic thing in this country to be able to collectively bargain what's going to happen to you at work. Studies recently coming forward about the violence at work towards nurses and other health employees. You know, there's no better way. I have teachers in my family who are also part of teachers unions, and I'll tell you what, those folks are under attack from a lot of pressures to say we're going to model our behavior after American business. You know, Trump, his background in business makes him not want to deal with a union ever. If he could possibly do it, he would not, because he doesn't cut good deals. This is not a man who knows any art form about dealing, and solidarity is the only way to go up against bullies like he is. And I happen to think he just puts on bold display for everybody to see what some CEOs think about in this country. Not all, but some. What they think about unions and the right to bargain and the right to strike and the right to do the things that have been protected since very long ago. So I think that unions must stand strong and tall. I personally was so blessed to work for the nurses, but in part because they're one of the most militant unions in the country, because they're not afraid, because they stand up and say what they believe is right. And that's what it takes with someone like Donald Trump.
So getting back to healthcare for all, Senator Bernie Sanders is spearheading efforts to introduce Medicare for all healthcare system in a bill backed by 15 of his 16 now yes. of his colleagues. Mm-hmm. Tell me what you think about that.
It's fabulous. And for those of us who watched Bernie Sanders and who paid attention to how many years this man has been fighting in the United States Senate to have even one other senator stand with him on Medicare for all and single payer. What an enormously powerful day September 13th, 2017 was, when Bernie Sanders did introduce the Medicare for All Act of 2017, S 1804. If you'd like to call your senators and tell them to get on board, that would be good. One of the greatest things that I saw during that experience was Elizabeth Warren of Massachusetts. When I was first in my post-Sicko days, I was one of the people featured in Michael Moore's film Sicko. And I always tell people, that's not something anyone aspires to do. Being in a Michael Moore film usually means something pretty obnoxious has happened in your life. Such was the case for me. But when I was first going around and about and speaking about health care, I testified to the House Judiciary and Congress about medical bankruptcy and debt. And sitting right next to me on that witness panel was a Harvard Law School professor who was one of the world's leading experts on medical bankruptcy, and that person was then Professor Elizabeth Warren. And while I was testifying, I heard her softly crying a little bit about how angry I was about how the healthcare system has destroyed what my husband and I took a lifetime to build. We no longer own a home, all the things that people experience in this system. And I have stayed in touch with her over the years, but what I didn't expect was, after she became a co-sponsor to Bernie Sanders legislation, I was in my car on the following Sunday afternoon and my phone rang. And the voice said, "Donna, this is Elizabeth Warren." And I said, "I recognized the voice. Hi there." And she said she just wanted to speak to me after she had finally become a co-sponsor of that legislation. I told her it was about time, after 10 years of people really pushing on her to do that, but it meant so very much to me that she had that humanity and that decency to call me, and she knew how much it would mean. And Senator Sanders isn't going to just introduce this and walk away. He is going to champion this effort so that more Americans hear their voices expressed in the United States Senate. More than 60% of the American public supports getting to a Medicare for all system, a single payer system. We can't let the scare tactics that other people put in our way dissuade us from doing what we know is right, which is economically smarter, and that truly covers everybody.
Right. I want to switch gears just a little bit and talk about seniors and marijuana.
Okay.
Very interesting topic. The Center for Disease Control has a new report out saying that marijuana use among adults over 65 years old increased more than 300% between 2002 and 2014, while they're still only making up about less than 2% of the population. Mm-hmm. What's happening here?
I think it's wonderful myself. I watch as various states, including Colorado and Washington State and District of Columbia and others, have legalized recreational marijuana, but also this acceptance that marijuana is safer in many ways by many studies than some of the other prescription medications that seniors might use. It also helps relieve anxiety and depression some. And one of the biggest examples I've ever seen, my own mom, who will be 90 years old in December. She lives in California, but she had polio when I was born. And for her, and I didn't know this until she got older and she told me, there's a thing called the post-polio syndrome that will set in, and it attacks the same joints and systems that the original polio virus damaged. So my mom has terrible pain in some of her joints and so forth, and she's this tiny little, slight little lady who has seen so very much in her lifetime, but she was just really, really hurting. And due to other problems she had, her doctor didn't want to prescribe her any other medication. Well, I asked her very gently, Mom, I know some people in California who might be willing to, let you try a cookie or something like that if you'll be very careful and you'll see. And to my surprise, she said yes, she would. And so my friend baked a batch of cookies with a little bit of marijuana, took them to my mother, and my mother would eat half a cookie every night, and she slept without so much pain. And I thought, wow, that's good. That's really good that so many seniors see it not only as a health benefit to them, and some can get medical cards to be able to buy, medical marijuana, but also, my gosh, in comparison to alcohol has done more damage in this society than any other drug, bar none. So I think the reality that marijuana is available to more seniors, some have experience with it from when they were much younger, some it's the first time that they're seeing a difference, and it cuts down on opioid use, which is great.
Well, that's a great segue. That was my next question for you. I mean, even President Trump has called it an epidemic in this country. But then there's been a shift in talking more about it, that it's the brain and how it's processing and really being triggered. Tell me your thoughts on the opioid situation.
Well, I fluctuate between being very angry with the drug companies for really marketing these drugs like crazy to physicians, so that was always the first line of defense, was to prescribe some opioid, whether it's Vicodin or oxycodone or whatever it may be. I know for myself, going to the dentist, and Bernie Sanders would give this example too, go to the dentist and sometimes you had a filling and maybe a little bit of work done, and the dentist might say, well, I can give you a prescription for Vicodin. You think, no, I don't think I need that. And it's really interesting that it's almost as if patients have to be proactive sometimes and say, I don't think so. I don't think I need that. But so many people have been prescribed opioids, and then because they can be then hard to get, because physicians eventually will decide they're not going to give another prescription, and it's expensive or can be for people, then they shift into heroin or they shift into some other medication. It's a public health issue. It's an issue of addiction. It's a substance. It's one that is a healthcare concern. It's not one of weakness. It's not one where people don't want to get help. Over and over again, you see people whose lives were upended by becoming addicted to pain medications, prescription pain medications. We have to deal with it as a health crisis and provide treatment with as much vigor as we do any other health benefit so that people can not be stigmatized by being called drug addicts and losing families and losing everything they worked for.
And you mentioned it's not about being weak or low moral character. I mean, in the 70s and 80s, we saw this problem with opioids in Black urban neighborhoods, and it was not addressed the way it has been now. And I'm just curious if you have any idea what changed.
Well, isn't that interesting? You know, white America decided it was a problem for them, I suppose. You know, and so often isn't that the sad part of a racist society, unfortunately, where if a problem is a problem in the Black population, it's due to the inherent, you know, lack of morals and all the things that racists will ascribe to people who are of a different color than they are. And yet when it becomes a crisis for white people, then sometimes we see the country react in a different way. We need to get past that. We really need to get past that. And it's a long slog, that's for sure. Those of us who lived through the 60s, and I was a pretty young girl at the time, but I will never forget what was done to Black Americans in this country during that time period. Talk about impressionable stuff. To watch people being hosed down in the streets with fire hoses on the evening news. And, you know, it's no different, even though it's quieter, it's no different allowing those communities to suffer with addiction issues or crime issues or any of the other problems that would be addressed if they were happening in a white community. It is no different. It is racism, structural racism that we need to address.
Donna Smith, thank you so much for your time. Such a pleasure talking with you. I've learned so much. If there are let me ask you one last question. If there's two takeaways that people should get from this conversation, what would you like them to know?
First of all, show up. Show up. I don't think it's nearly as important where or how or with what group or what affiliation. Show up right now for this country and for your community and for the people around you who may be suffering and you don't know it. And secondly, we are better than this. And perhaps if we all hang together in solidarity through this period, we will come through stronger than we started. It's mind-boggling right now, but I think we can come through stronger if we hang together. But remember, just ask people around you. There are a lot of people scared and nervous and angry and upset right now, and we have to hang together.
Great. Thank you so much for being here. Thank you to Donna Smith, Executive Director of Progressive Democrats of America. I'm Tamara Banks. Thanks for joining us here on Free Speech TV for this important conversation on healthcare in America. We'll see you next time.